Thank you very much for inviting me. So I'm the odd one. So I'm not an MBBS doctor, but I did my PhD in computer science and IT. I'm a technology guy. So, if I start thinking about the healthcare and the artificial intelligence, long back I was invited by the Rajiv Gandhi Cancer Hospital, and they invited me to discuss that in one of the tests which they do for the prostate cancer, the testing was much more painful for the patient than the actual, the process to remove or care. And they said how the artificial intelligence can help them from different kind of parameters to diagnose whether there is a need for a test or not, and how can we do it. And it was a very different kind of thing for me because I had never thought of getting into the medical science. And then we started working, and we were able to do something by which we were able to predict to a 90% more level with other parameters, not going and testing the prostate, taking a sample and making it much more painful for the patient, and how to care. So that was artificial intelligence when we created different kind of models. And at that time, the language was not LLM or anything, but we were trying to do it. It was long back. And then they started using it. Now it is being used. And when I saw the Tata Memorial using for many other things, I can see how what we were trying to do long back has really worked. In a similar fashion, so that's more on the diagnosis part. But when we think about the research, because many times, we have the research, the vaccines. And when we start thinking that the polio vaccine or the smallpox vaccine took multiple years to come and become usable for the human. But the vaccine for corona was in India, I think around 6 months, and sir will be in a better position to tell that. 11 months. Okay. So in 11 months, how are we able to test on so many humans and get the results and say that, okay, on this particular group of people, this will act like this. This is the group of people, this is going to act like this. This is all because of the kind of models that were already available. Okay. So from the research to diagnosis, and then coming to the, the doctors, or the way doctors work. So yesterday I was seeing a different kind of organization where the doctor-patient conversation is getting recorded by an AI tool. And the kind of, there is a clause which they use, the pajama times. Okay. The doctor's pajama time, when they are relaxing, is when they are seeing all what they had done in the day and trying to record it. The history of the patient whom they met, what kind of diagnosis they could feel, what are the records, and they're creating all the kind of, the documentation required for the hospital to ensure that they have diagnosed a person correctly. Now this is a machine which is sitting in front, just listening to the doctor and the patient, and that is creating all the history of the patient's, father, historic data, what happened. So what you see as a doctor writing and trying to say, okay, this is what the reason why I diagnosed it like this, and this is why I'm giving this prescription, is all getting recorded. And it's all because of the artificial intelligence, because that voice recording, they are checking which is the doctor, which is the patient, what is the patient saying, how can we have in the same format and a template in which the hospital requires it. Okay? And that's again the artificial intelligence. All the variables are using the artificial intelligence. And recently, most of you are here from the allopathy. There is a in IIT Kanpur, a lady has been able to create from the Ayurvedic purpose. So there's a sensor which is going to see your nadi, and from the, I don't remember the exact thing, the kaph, pat, pith, and vak. Okay, vat, pith. Okay, they will be able to predict it, and they will be able to diagnose it as per their science. Okay, but till this date, we all have seen the blood pressure and the other kind of, the medical, the allopathic sciences telling us some kind of thing. They have been able to create for the Ayurvedic science. And they are able to predict what is your condition and how you will behave. Now there's a Ayush Mantralaya, they are giving them an order, and we are trying to work with them. But while, I have 8 minutes to speak and 6 minutes are over, so I have 2 more minutes to talk. Unless the patient, one thing which the doctor from the Tata Memorials clearly said, that my team now includes the technical guys. Okay? It was a very good statement which he made, that now not only the doctor, I have some technical engineers with me. That's a very big change that has happened in the way this this group has started thinking. I'm not sure how many of you are aware, but I was in IIT Delhi, where I found a joint venture being created between the All India Institute of Medical Sciences Delhi and IIT Delhi. School of Biodesign. And they worked on the neuro therapy, and they're able to create a robotic arm. So a person who has gone through a stroke, it's going to give the electric signals, reverse electric signals, which will go to the brain and try to hit the clot. And we'll try to see how that human can behave, much faster than if, and it was found that in 6 months, if there is a recovery, because of that, it is 6 weeks. Okay. Now it is getting into commercial, and there I was also involved to see how can it become commercial and how can we take it to the market. But the thing is, there's a need for the technology guys now start talking to the subject matter experts who are doctors. Doctors themselves are technically very sound, but sometimes what technology can do as per sensors, how the sensors data and how the sensor data can be analyzed is something people like me will understand slightly more than you. And that involvement is something which is very much required for creating that foundation models and creating them better and better. The last thing which I want to speak, and only 1 minute, which I am really touched about. We are a mobile manufacturers, okay? And I am invited here. We sell wearables and we do. We have a feature phone, okay? It's a 1200 rupee, 1000 rupee phone with a keypad, but it has a speaker. It has a microphone, okay? It's a vibrator. I got a call from a village in Anand, a decently aged person who was having a hearing aid. And he was from a very humble family. And he said, Dr. Bhatnagar, मैंने जो है आपके फ़ोन को यूज़ करके hearing aid बना दिया है. So I said, okay, can you get me into a call? And we got into a video call, and I invited my product team and my technical team. He said, see, you have a speaker, you have a microphone. What I have done, I have created an, he could not say that, but it was a model that he had created by which he can see what is the level of hearing problem in the ear, at what level that has to be set, so that using the microphone of my phone, which is 1000 rupee or 800 or 1200 rupee, using the same thing and give them the hearing aid problem resolved. Okay? And that is what is required when the patient themselves will start talking to the technology and try to find what can be the solution for them. Today, we are testing it on 1000 hearing aid challenged people. If that will work, and there is a possibility that we might have to tweak something in the algorithm, but if it will work, we won't be charging for it any additional. Because at 1000 rupee, if I'm going to give free, I'm not sure how many of you are even aware of this. There are 250 million Indians, 250 million Indians who still use that feature phone. Okay? And the people who are still being able to buy a 5,000 or 6,000 rupees smartphone, they do not have money to pay 200 rupees for the data. So out of the, so many 1.4 billion people, 250 million still use feature phone. And many of them must be having some hearing aid problem. If I'll add that algorithm or into it and do not charge, it will be a feature that will go for the hearing aid issue. We have multiple examples of such, but with this time, I think there's a huge amount of things that we can do together. Thank you.